Hi everyone, moving on to next EC topic. This EC is done in classroom setting with the help of one or two case charts and a video. Okay, first I'll show a case chart. So this is the chart. A 35-year-old man presents to the emergency department complaining of dark stools for the last 2 days. He has had epigastric pain for 2 weeks that improves after eating and is worse at night. He has had nausea and feeling of fullness after eating small amounts. He has not had difficulty swallowing or unintentional weight loss. He is a construction worker and takes naproxen several times a day for back pain. So once the patient was presented with these symptoms, examination was done. Okay, so that's what is given in the next paragraph. Vitals are notable for a heart rate of 100 per minute. On exam, he has mild tenderness to palpation in epigastrium without rebound tenderness or guadi. Rectal exam shows a small amount of black stool in the rectal vault. Hemoglobin has dropped to 9 gram per deciliter from 11 gram per deciliter several months ago. Okay, so you might be knowing the diagnosis. So I've taken this chart to make you understand like what are points you should note, and from that points what you should be understanding. Okay, what diagnosis or what conclusion you should make out. Okay, so he is having dark stools. Okay, so dark stools is otherwise mentioned as melena. So what is it telling about? Maybe in anatomy at least you would have learned. Okay, so one of the reason for having dark stool is upper GI bleeding. Okay, if there is bleeding from some part of the upper GI tract. Upper GI tract means some part above second part of duodenum. So once this blood is being metabolized, when they pass stool, the stools will be dark in color. Okay, but if the patient is having lower GI bleed, they will be passing blood as such. Okay, it will be red color or red stains will be there in the stool. Okay, so if it is dark stool, it means there is a GI bleeding and the source of bleeding is from somewhere upper part of the GI tract. So these things again you will be learning in your coming years in your surgery. Okay, so this is just to give a clinical exposure in the first year. Okay, then that is the one thing you have to note. Okay, then what is the next thing? They are highlighting the important things here. Okay, he had epigastric pain that improves after eating. Okay, and he had nausea and a feeling of fullness after eating. So pain, epigastric pain means what should come to your mind? Peptic ulcer. And that improves after eating means which part? Duodenal ulcer. Okay, and then there is one more symptom, a feeling of fullness, and that is known as dyspepsia. Okay, so again those things we'll be learning in surgery in the coming years. Again it is a feature presentation of peptic ulcer. Okay, so that is the next thing. Then what other point is there in this question? He is a construction worker and takes naproxen several times a day. So naproxen is a painkiller. Okay, so what is that? It is an NSAID. Okay, so again it is one of the cause for one of the thing which is predisposed to peptic ulcer. Okay, so mechanism and all I have already dealt in theory class, so I am not explaining. Okay, so again this is just to make you understand from a case what all things should strike your mind and what you should think about it. Okay, what else? He is having mild tachycardia. Okay, keep in mind mild tachycardia, I'll come to it. Then rectal examination shows melena, because when a patient tell dark stools you have to confirm it. Okay, so again when you are learning GIT examination in the coming days as well as the next year, you will understand even the examination of rectum per rectal examination is a part of GIT examination. Okay, so that revealed that he is having melena. Okay, so you should confirm what patient is telling. Then what else you should note in this case chart? Okay, so hemoglobin has dropped to 9 from 11, which was there several months ago, which means there is a subacute hemoglobin drop. That's what they are telling, which means he is having this bleeding for some time. That's why he is having a hemoglobin drop as well as dark stools. Okay, so what is it telling about us? He is having a peptic ulcer, and that too it is bleeding. Okay, so sometimes the ulcer can bleed. Okay, so now what is the best next step in the management? What should be done to this patient? What should be done?